Now, anorexia nervosa is basically a kind of a delusional eating disorder. In this, what happens basically is that the person stops eating, and that is going to hinder his day-to-day life. The clinical features would generally suggest that the person is underweight and he's not going to eat properly, and that is going to affect his daily routines. So that is what we are discussing over here in this section. The SCOFF scoring questions are again very important. When the patient basically comes up to you, he's an underweight, fatigued, and anorexic person, and that is very easy to diagnose these people in general. But again, the questionnaire is going to be very important for such people. There's a thin borderline between the normal eating habits of the people and the anorexic eating habits of the person. So that is going to be highlighted by this SCOFF scoring questionnaire that we'll be giving to the patients. Now, anorexia nervosa, how do you define this condition is again very important. There are going to be particular delusions, and that are going to basically involve that the person stops eating after these delusional disorder. He's going to think about himself that he's an overweight person, and that is going to hinder his life. So we are going to basically perform the counseling sessions and the CBT sessions along with the pharmacotherapy. Sometimes the pharmacotherapies are also combined with these CBT sessions to basically counsel these individuals. The history taking is again very important over here, and obviously we'll be discussing the risk factors. Whenever we are discussing any psychiatric illness or any mental disorder that is affecting the lifestyle of that particular person, it's basically the environmental risk factors along with the personality disorders of that particular individual that we are going to highlight. So there are some peculiar personality traits that is going to make that particular person prone to this pathological condition, which is known as anorexia nervosa. So basically what happens over here is that any of a range of psychological disorder characterized by abnormal or disturbed eating habits. So these eating habits are going to be disturbed. He's going to restrict himself from eating, and even if he eats properly, he's going to vomit it out. He's going to try to vomit it out. Basically, a lot of people try to use the diuretics or even enemas or even purgatives to get rid of the excess food that they thought that they have eaten. So that is again a pathological process, and all of these enemas and these antacids and these diuretics, they are going to have their adverse effects on the body of that person as well. So even they are going to be taken into account whenever we are treating these disorders of anorexia nervosa over here. So it's basically a complex mix of biological, psychological, and social factors. So the social factors even play their role in the psychology or in the making of the delusions of these particular overweight phenomena in this particular pathology. Psychological phenomena are going to be there, and then there are a lot of comorbidities that can coexist with these psychological traits in the particular person. Now, we have basically devised a SCOFF screening questions. Do you make yourself sick because you feel uncomfortably full? So this is again one of the questions that is going to be put forth to that person that whom you think can be categorized as suffering from anorexia nervosa. You're going to ask him whether he feels uncomfortably full all the time or not. Then do you worry you have lost control over how much you eat? So it's again a very important question of this questionnaire. Have you recently lost more than 1 stone in 3 months? So it's again very important. How much weight have you lost? And if it's a drastic weight gain, there has to be some cause behind it. If it's not some organic cause, if the person is not suffering from any malignant diseases or any other weight-losing diseases, for example, diabetes or tuberculosis, then you have to rule out any psychological cause that can lead to the severe weight loss. Do you believe yourself to be fat-free when others say you're too thin? So it's again one of the questions that is going to highlight the thought process of that particular individual that we are talking about. Would you say that food dominates your life? So these pessimistic thoughts are going to be seen in the thought process of that particular person. He's going to feel that he's fat. He's going to feel that his attitude towards food or taking food is not normal. He would think of himself that food dominates his life, or he has overeaten, or he's overweight. All of these pessimistic thoughts are going to be there in his mind. Now, how do you define this condition, which is known as anorexia nervosa? And it's basically an eating disorder, and there is a range of eating disorders which we'll be discussing subsequently, including even bulimia nervosa. And over here in this lecture, we are focusing on this particular disorder, anorexia nervosa over here, which is also known as holy anorexia. Now, while we're defining this disorder, it's basically an eating disorder which is characterized by low weight or fear of gaining weight and a strong desire to be thin, resulting in the food restrictions. So there are some particular terminologies which you'll have to focus on. First of all, there is a low weight phenomena over here, and then the fear of gaining weight. So this strong fear that he has that if he eats properly, he's going to gain weight is one of the component of this pathology. Then a strong desire to be thin, resulting in the food restriction. So food restriction is the baseline again over here that we have to focus on while we are defining this pathology. Now, after we have done the complete definition of this condition, obviously the history again is very important for this condition. Lasik in 1873 and Gull in 1873, they described this illness affecting the young women characterized by severe weight loss. And they labeled them anorexia hysterique or anorexia nervosa. So these were the pioneers of discovering this disease. And then Simons in 1914, he found lesions in the pituitary of the emaciated patients. So this was the organic cause for the formation of this anorexic thoughts. Basically, he speculated that these lesions had an endocrine etiology. So anorexia nervosa basically had an endocrine etiology according to him. Then Bruch in 1973 or in 1978, he conceptualized anorexia nervosa in terms of the low self-esteem and body distortion. So it's again another way of looking at this pathology. Having a low self-esteem or having a low body imaging is again going to be one of the component over here. Muchin et al. And Palazzoli view anorexia nervosa as an expression of family psychopathology. So it's basically running in the families. Now, when we move on to the prevalence, the Western societies, we have 0.3% among the young females, and the rates are among in adolescents, they're around 1%. The risk factors, they basically include the socio-demographic factors, and the biological factors can basically include and they can conclude to this condition. Then we have the psychological or the medical factors. So if the person has some other comorbidities, for example, if he's suffering from any other terminal illnesses or any other chronic illnesses, that will be an additional factor to manipulate this condition. Then there are a lot of socio-cultural factors. There are a lot of societies in which weight gain is quite a phenomena over there, and that's why these delusions are part of that society. So in this section, basically, we had an overview regarding this condition, which is known as anorexia nervosa, and it's one of the eating disorders that we have to deal with. So that is the end of this section. Thank you for watching sqadia.com.